Welcome to another edition of A New Me, your weekly consultation with the Washington, D.C. area's best doctors and professionals. Our guest experts help you learn about the latest medical advances and procedures by providing you with the real information necessary to help you eliminate the dangers of making the wrong medical and cosmetic enhancement decisions. Get ready for your consultation.
Coming up, we'll be on location in Woodbridge, Virginia with Dr. Douglas Heritage, discussing pelvic pain treatment with one of this area's top OB/GYN physicians. Dr. Heritage has over 30 years of experience and has treated numerous grandmother, mother, and daughter patient groups. Welcome, Dr. Heritage. Thank you for sharing your time with us today. We've got a lot to cover, so let's get right into the questions. Can you tell us how prevalent pelvic pain is today among women?
It's a very common problem. It's hardly a week that goes by that I don't see one or two cases of pelvic pain.
And what are the most common causes of pelvic pain?
Well, there are acute causes and there are chronic causes. And by acute, I mean episodes of pain that may be sudden in origin and of relatively brief duration, as opposed to chronic pain in which it is an ongoing problem, maybe for months, even years, and tends to be progressively severe over time.
I see.
Of course, the most common complaint would be painful menstrual periods, what we call dysmenorrhea. Other common problems would be ovulation pain and the rupture of a benign ovarian cyst.
How severe can this pain be?
Chronic pain can be broken down probably into three common categories. First would be endometriosis, the second a condition known as adenomyosis, and the third would be pelvic adhesions.
That's interesting.
Endometriosis is a chronic disease. It's a benign condition. It's not cancer, and people don't die from it. But it becomes progressively severe over time. And as it damages the internal organs, it can even result in infertility. It's a condition where the lining of the uterus, the endometrium, begins to grow outside of the uterus, but within the abdominal cavity. And it invades the local tissues and causes a good deal of inflammation and irritation. Adenomyosis is very similar. It's a condition much like endometriosis, except it's a condition where the lining of the uterus, the endometrium, invades into the muscular portion of the uterus alone.
And what treatments are currently available?
Well, the treatment options would depend, of course, on the nature of the complaint. If we're talking about an acute problem, many times the best option is to do nothing. For example, a ruptured ovarian cyst can cause intense pain of sudden origin, but will go away completely within a couple of days. Painful periods oftentimes are best dealt with either medications that prevent the release of prostaglandin, like ibuprofen, or on occasion, if it's appropriate, the use of birth control pills. If the problem is more severe, then of course the cure or the plan has to be adapted to the particular problem.
What are the benefits of this procedure as opposed to other options?
Well, obviously, medical treatment for almost all concerned would be preferable to any sort of surgery. It's certainly much easier to take a pill than it would be to undergo a operative procedure. It's very appropriate for some conditions, and it can also be used as a secondary treatment in certain conditions, such as endometriosis or adenomyosis. Some conditions such as endometriosis or adenomyosis or certain pelvic adhesions can only be treated satisfactorily with surgery. Endometriosis requires estrogen to grow. If estrogen is not present, such as in the young child or the elderly lady, it will go away by itself. Medical therapy for endometriosis or adenomyosis involves medications which restrict the production of estrogen in the female, allowing a window of time to develop where she may become pregnant, for example. Other conditions are more severe conditions of endometriosis or certainly pelvic adhesions, which cannot be treated with medication, require the use of surgery. There are a number of different procedures which can be used, but almost all would initially involve what's known as laparoscopy, in which a telescope is inserted under general anesthesia through a small incision in the umbilicus, and the pelvis inspected. Now, endometriosis is a condition which can only be diagnosed by visualization and sometimes even with biopsy. There is no x-ray, there is no ultrasound, there is no blood test which will diagnose endometriosis. One must see it, and that's how it's done with the laparoscope. In most cases, it has a very characteristic appearance. Sometimes it can be elusive and require a biopsy of the pelvic tissue in order to make the diagnosis.
And how long does the procedure generally take?
Well, the procedure depends upon exactly what's done, of course. If it's simply a matter of looking and making a diagnosis, it may take no more than a half an hour. Generally, however, if I find endometriosis or pelvic adhesions, in almost all cases, I can then do something through laparoscopic incisions, requiring nothing more than Band-Aids to make things better, either by using, for example, a laser through the laparoscope to vaporize the lesions, or using scissors through the laparoscope to cut the adhesions. We have a number of different techniques that can be employed depending upon the severity of the condition and its exact location.
What type of results can be expected?
It varies, again, according to the nature of the complaint. In the case of endometriosis, I tell all of my patients before we even go into the operating room. Results vary. I've had many patients, and I've done hundreds of these cases, in which there was complete relief. The vaporization was successful, the patient apparently was cured and never had any more complaints along those lines. Unfortunately, I've had patients that seem to have the same extent of disease. I did exactly the same thing and they really never got any better, and we had to turn to another form of treatment such as the medicine I alluded to. And then there is a group of patients that definitely improve, but they're not 100% better. So with the endometriosis condition and laparoscopic treatment, anything from complete relief of symptoms to no relief is possible. All we can do is do the procedure and see how the patient responds.
We'll now be speaking with a patient of Dr. Heritage and learning about her experience here. Welcome. Thanks for being here today.
Hi, thank you for having me.
Could you please begin by telling us some of the problems that you were having and how they were affecting your life?
Yes, at a young age, I began having really unmanageable cramps and pelvic pain as well. As I grew up, I realized that a lot of other girls were not having those same pains, and specifically with the hospital visits that I was having to have every time I would come on my menstrual cycle. I realized that was not normal. So in 2009, I came to Dr. Heritage's office to see if there was any solutions to the problems that I was having, because it really did kind of debilitate me when I was having to go through that pain, especially in college, trying to do things that I wanted to do.
What did you have done?
We tried birth control to see if that would maybe help some of the pain of the cramping. That really did not work for me. I continued to have pain and be hospitalized. So what we did was he recommended that I would have a laparoscopic exam and laser removal of anything that maybe he was to see.
And how long did the procedure take?
I would say it took about 4 hours in total, the whole procedure from start to finish. It was an in and out surgery.
What was your recovery time?
After the surgery, I would say within the first few days, I was able to get back on my feet and go back to work. However, it took about 3 weeks for me to totally get back into my normal routine.
How do you feel about the results?
Oh, I'm very pleased about the results. I have not had any pelvic pain or any cramping like I had before, so I'm completely pleased with the results.
It's great to hear. So would you recommend Dr. Heritage to others who may be watching who are experiencing pelvic pain?
Yes, absolutely. I would definitely recommend him, because For any female who has pelvic pain or any type of menstrual cramps that are just not normal, I would say that you should definitely come to him as soon as possible and see if there's anything that can be done about those things.
Thank you very much for coming and sharing your story with us today.
Thank you for having me.
Are there any follow-up visits required?
Oh, quite absolutely. The disease hopefully is eliminated with the treatment, either medicine or with surgery, but it may recur. After all, you can't put a laser beam on what you can't see. And we can laser all the visible lesions, but remember that this disease starts as a microscopic cell, and that can't be visualized at the time of laparoscopy. So it's not terribly uncommon for a patient to get excellent relief that may last for years and have the disease come back at some later time and require some other treatment. Accordingly, I like to see my patients on a regular basis to see how they're doing.
You're recognized as a leader in this area in treating pelvic pain, and you've established an excellent reputation with patient care as well. What can you tell our viewers that sets your practice apart from others in this area?
Well, of course, there are many good practices in the area, but I believe mine is rather unique in that I've been in the Woodbridge area for 30 years. I have many patients who are second, even third generation patients coming to me. And that's really quite important because I get to know my patients intimately, almost as a family. And certain diseases, such as endometriosis, actually do run in families. I can remember several instances where the grandmother, the mother, and the daughter, all my patients have all had endometriosis that I've treated. I believe that getting to know the patient and being able to talk to the patient on an individual basis is really the most important part of medicine. Many times I can have a 90% positive idea of what the problem is before we ever go into the examining room, simply by listening to the patient's symptoms. I thoroughly enjoy what I do. I try to stay abreast of all of the latest technology in dealing with these issues. And most of my patients are very satisfied. They come back to me every year. We have a good time meeting again. And then they refer their friends and family to me as well.
That's wonderful. Well, thank you very much for your time, Dr. Heritage, and for having us here. You've been very helpful.
Thank you very much for having me.